Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about Cushing syndrome. Cushing syndrome, named after the famous neurosurgeon Harvey Cushing, who first described it. It is an endocrine disorder with elevated cortisol levels in the blood. In some cases, Cushing syndrome results from a pituitary adenoma making an excess ACTH. And in those situations, it's called Cushing's disease. Normally, the hypothalamus, which is located at the base of the brain, secretes corticotropin-releasing hormones known as the CRH, which stimulates the pituitary gland, secretes the adenocorticotropic hormone known as the ACTH. ACTH then travels to the pair of adrenal glands on top of each other. What specifically targets cells in the adrenal cortex? The adrenal cortex is the outer part of the adrenal gland and is subdivided into three layers: the zona glomerulosa, zona fasciculata, and the zona reticularis. The zona fasciculata is the middle zone and also the widest zone, and it takes up the majority of the volume of the whole adrenal gland. The ACTH specifically stimulates the cell in the zone to secrete the cortisol, which belongs to a class of steroids or lipid-soluble hormones called glucocorticoids. Glucocorticoids are non-soluble water, so most cortisol in the blood is bound to a special carrier protein called cortisol-binding globulins. And only about 5% is unbound or free. In fact, only the small fractions of free cortisol is biologically active, and its levels are carefully controlled. Excess-free cortisol is filtered in the kidneys and dumped into the urine. Free cortisols in the blood is involved in a bunch of stuff, and it's part of the circadian rhythm. Cortisol levels peak in the morning when the body knows we need to get up and go, and then drop at night. When we're getting ready for bed, in times of stress, the body needs to have a plenty of energy, of substrates around. So cortisol increases gluconeogenesis, which is the synthesis of new glucose molecules, as well as the proteolysis, which is the breakdown of the proteins, and lipolysis, which is the breakdown of fats. Cortisol also helps to maintain the blood pressure by increasing the sensitivity of the peripheral blood vessels to catecholamines, like epinephrines and norepinephrines, and this narrows the blood vessel lumen. Cortisol also helps to dampen the inflammatory and immune response by reducing the productions and release of the inflammatory mediators, like prostaglandins and interleukins, as well as inhibiting the proliferations of the T lymphocytes. Finally, cortisol receptors are present in the brain where their full effect is still actually unclear, but might influence things like mood and memory. For all this to work properly, though, the levels of the free cortisol have to stay with the normal range. To do that, the body uses a negative feedback, which means that the high levels of cortisols tell the hypothalamus and pituitary gland it decreases their secretions of the CRH and the ACTH respectively. Less CRH also tells the pituitary gland to make the less ACTH. So the pituitary gland ends up having two reasons not to make the ACTH. With less ACTH floating around, the zona fasciculata gets less stimulations to make cortisols, and eventually cortisol levels go back down to the normal range again. In Cushing syndromes, cortisol levels are constantly higher than the normal, so its effects are exaggerated. Excess cortisol leads to severe muscle, bone, and skin breakdown, which are the major proteins. First, they amplify the effect of the catecholamines and blood vessels, and the second, cortisol starts to cross-reacting with the mineralocorticoid receptors. Differentially targets adipocytes or fat cells in the center of the body around the waist and the buttocks. In those cells, the insulin activates lipoprotein lipase, which is an enzyme that helps those adipocytes accumulate more fat molecules. First, they amplify the effect of the catecholamines and blood vessels, and the second, cortisol starts to cross-reacting with the mineralocorticoid receptors, which normally only bind the related steroid hormones. Mineralocorticoid, which are secreted from the zona glomerulosa layer of the adrenal cortex. In other words, because the cortisol is structurally similar to mineralocorticoid, it can bind that receptor and can trigger the mineralocorticoid effect. which is mainly to increase the blood pressure by retaining the fluid. High levels of cortisols also inhibit the secretions of the gonadotropin, releasing hormones from the hypothalamus, which messes up the normal ovarian and testicular function. Excess cortisol also dampens in the inflammatory and immune response, making individuals more susceptible to infections. Finally, high levels of cortisol seem to impair normal brain functions, but the exact mechanisms here is unclear. Cushing syndromes can happen because of the exogenous cortisols, meaning that it came from the outside, usually in the form of the medications, but it also can happen because the endogenous cortisols, meaning that the excess cortisol is made up by the body. The majority of cases of Cushing syndromes happens in individuals using exogenous steroids medications over the long period of time. Since that's the widest part of the adrenal cortex, it can have the measurable effect in the overall size of the adrenal gland. Even though this results in less endogenous cortisol productions, it still doesn't quite compensate for the huge levels of the exogenous cortisols. And that causes Cushing syndrome to develop. In addition to taking exogenous steroid medications, Cushing syndrome can also result from the increased levels of endogenous cortisol. The most common reasons for that is excess ACTH. The leading cause of that is the pituitary adenoma, which is a benign tumor of the pituitary gland. And the specific conditions is called Cushing's disease. The exact reasons for the development of this sort of benign tumor isn't known. But unlike a malignant tumor, the cells don't invade neighboring tissues or spread to other parts of the body. Instead, the pituitary adenoma simply grows in size and secretes too much ACTH. The excess ACTH overstimulates the zona fasciculata in both adrenal glands, which grow larger and secretes excess cortisol. Apart from pituitary adenomas, there are ectopic sources of ACTH, like small cell lung cancer. In these cases, the excess ACTH is coming from somewhere other than the pituitary. Another common cause of endogenous Cushing syndrome is tumor of the adrenal glands that makes excess cortisol, like adrenal adenomas, which are benign tumors, and adrenal carcinomas, which are the malignant tumors. In both adrenal adenomas, carcinomas of the cell of the zona fasciculata within the adrenal cortex start dividing abnormally and secretes excess cortisol. As before, the excess cortisol provides negative feedback to the hypothalamus and pituitary gland. Suppressing both CRH and ACTH productions, also this doesn't have an effect on the zona fascicular to be involved in the adrenal gland. Since the neoplastic cells are autonomous, meaning they have grown independent from any stimulatory signals, zona fasciculata of the involved normal adrenal gland shrinks and produces less than the standard amount of cortisol. The net result, though, is still abnormally high levels of cortisol, and that causes Cushing syndrome to develop. Regardless of the causes, symptoms of Cushing syndromes are directly related to the effect of the cortisol on its various target tissues. Resulting from the increased breakdown of the most types of tissues, the individual presents with muscle wastings in the extremities, skin thinning, easy bruising, and abdominal striae or lines, as well as the fractures due to osteoporosis or brittle bones. At the same time, there's a fat redistribution, so classic findings include a round, full, moon-shaped face, a buffalo hump, which is a fatty hump on the upper back, and the truncal obesity or fat gathers around the abdomen and trunk rather than in the limbs. Finally, excess cortisol causes hyperglycemia or high blood sugar levels that can progress to diabetes mellitus, hypertension, or increased blood pressure, along with the high risk for the cardiovascular diseases, as well as increased vulnerability to infections or wound healing, amenorrhea or absence of menstrual bleeding, and psychiatric or mental disturbances. Diagnosis of Cushing syndrome is initially based on measuring the free or unbound cortisol in 24-hour urine sample, in order to assess the total amount of cortisol excreted in the urine over a 24-hour period. Alternatively, blood or saliva tests late at night can help check if there's a normal daily rise and fall of cortisol levels. Another option is also the dexamethasone suppression test, which is when a person is given a low dose of dexamethasone, which is an exogenous steroid that suppresses the ACTH productions in the pituitary gland. Normally, that should cause a decrease in the serum cortisol levels, but if Cushing syndrome is caused by endogenous cortisol productions, and the serum cortisol levels should remain unchanged. If that test is positive, the next step is to determine the exact cause of endogenous cortisol production. And the ACTH plasma levels can be checked. Low ACTH levels can be seen in adrenal adenomas and carcinomas, whereas high ACTH levels can be seen in Cushing's disease and ectopic ACTH production. If the ACTH level is high, the next step is to give an injection of a high dose of dexamethasone. Unlike pituitary adenomas, ectopic sites of ACTH productions typically don't respond even to high doses of dexamethasone, and the serum cortisol remains high after all the imagings can be used. Or a CT of the chest and abdomen or pelvis if this seems to be an ectopic side of the ACTH production. Treatment of Cushing syndrome depends on the underlying cause. If it's due to exogenous medications, then the offending drugs is gradually decreased and eventually stopped as possible. It is important to avoid the sudden steroid withdrawal because that can cause the adrenal crisis, which is the life-threatening. That's because the adrenal glands might be atrophy and might need to recover fully, and during that time, the body needs exogenous steroids to function normally. If Cushing syndrome is due to a pituitary adenoma, like in Cushing's disease, and surgical incisions like the adenoma might be needed. Alternatively, medications like adrenal steroids inhibitors, like ketocon, is all on the material bone can be helpful, especially for the cases of ectopic ACTH productions or adrenal carcinoma is that have already spread.